Thanks for joining us for KSAT News at 9. I'm Patty Santos. Coming up, the mayor will join us to answer viewer questions about COVID-19. The city of San Antonio announces it's furloughing 270 employees, plus a look at how CPR instructors are having to adapt to this health crisis. But first, more residents at the local nursing home at the center of a COVID-19 outbreak have died. The death toll at Southeast Nursing and Rehabilitation Center now stands at 10, and a total of 20 people have died in Bexar County. Meanwhile, there are 51 new confirmed cases in Bexar County. That brings the total number to 554. Of these, most cases were contracted through close contact with an infected individual. 155 are cases of community spread, 132 are travel related, 84 patients are currently hospitalized, and 41 are on ventilators. 92 people have recovered. The deaths at Southeast Nursing and Rehabilitation account for half of all COVID-19 related deaths in Bexar County. KSAT Still Collier spoke to a therapist who resigned from the center after she says they didn't do enough to prevent the virus from getting inside the building. The staff occupational therapist quit March 20th after she claims a co-worker told her he was encouraged to keep working even though he had possibly been exposed to the virus through his girlfriend. Instead of isolating, the man kept showing up for his shift.
Personally, I think he should have self-quarantined, but he didn't, and he was not told to by our company.
Coming up on the Night Beat, you'll see the therapist's outcries and how her supervisors responded to them. You'll also hear how her former employers now believe she abandoned her patients. Southeast Nursing Home and Rehab Center is a member of the Texas Healthcare Association. The president of the association says there are more than 3,200 nursing and assisted living facilities across the state. Facilities are trying to keep up with the quickly changing information and protocol requirements, but he says they face an uphill battle with the shortage of personal protection equipment and not enough testing kits available.
One of the challenges, as I'm sure you know, and that makes this virus so difficult is the frequency that's been seen of individuals who were asymptomatic, who showed no symptoms, but yet when tested, they tested positive. And so the availability of testing that is out there to identify and to isolate and to quarantine, whether that be residents or staff, to protect others.
A shortage in staffing was present long before the pandemic and is now made even more difficult. Currently, waivers are being approved to allow non-clinical staff, second-year nursing students, and modified training requirements to be able to fill in those gaps. If you have lost your job and are willing and caring enough to step in, try applying for one of the many jobs available in nursing homes. Now, as many local businesses remain closed, one local woman is continuing to teach an important course, CPR. The owner of CPR Providers says they are keeping healthcare providers credentialed during this pandemic, but they are also taking precautions to keep everyone safe. Tiffany Huertas has a look at the changes they've made.
Before this all happened, I would fill my classes for up to maybe 9 to 11 students. In my office, and we'd have a class. And now that all this has happened, I'm down to 1 to 3 students per class.
Joyce Fuentes is the owner of CPR Providers located along Culebra Road. The facility offers CPR and first aid training certification based on guidelines from the American Heart Association.
For nurses, CNAs, anybody who works in a hospital setting, with the situation that we're living in today, we want to do hands-only CPR.
Lately, she's seen many people sign up who are stepping up to help during the pandemic.
So I've had about 4 nurses, past 2 weeks, that have come out of retirement prepping to be called back.
Joyce says they have been constantly cleaning the facility and they are making sure everyone who takes their class is staying safe during the coronavirus pandemic.
We have hand sanitizers everywhere here in the office, and then everybody gets their own mannequin. We don't share mannequins.
The American Heart Association made recommendations for their training centers. It says instructors should decontaminate the mannequins, face shields should not be used, and direct mouth-to-mouth ventilations should not be practiced. Each student must be provided with a CPR pocket mask and one-way valve when practicing one rescuer skills. Bag masks should be used when practicing two rescuer skills, and participants should wear gloves and clean bag masks between practices.
We've always been practicing lots of, I guess precaution, safe measures like that to begin with.
For the 9, Tiffany Huertas.
Well, Texas Governor Greg Abbott announcing today that the Texas Health and Human Services will provide more than $168 million in emergency SNAP benefits. The money will be for April and May and will affect all SNAP recipients in Texas. Disbursements will be staggered and will begin tomorrow. The maximum SNAP amount for a single person will be $194, and for a family of 4, $646. Recipients will see the additional amount in their Lone Star cards by April 15th and May 15th for the next month. The San Antonio Food Bank released a statement about the emergency SNAP benefit, saying in part, quote, "It is a step in the right direction, but there is still a long way to go to help those suffering in our community," end quote. The food bank has seen a massive increase in families needing help amid this pandemic. Well, like many other industries, San Antonio's tourism industry has been devastated by the pandemic. And today, the city of San Antonio has announced that it will furlough about 270 employees who work in the departments that rely on revenue generated by the hotel occupancy tax. This includes employees at the Henry B. Gonzalez Convention Center and the Alamo Dome. The furloughs begin April 23rd and are expected to last through July 31st. The city says employees will receive regular pay from April 9th through April 22nd and will continue to receive health care coverage. Tonight, we've also learned that public arts organizations are losing city money. Arts agencies are also funded through hotel occupancy taxes. The mayor says for the remainder of the fiscal year, which ends in September, there will be a 20% reduction for arts agencies across the board.
There was a famous adage, during wartime, people would cut arts funding, and someone said, "So, well, why are you fighting? What are you fighting for then?" Arts and culture are such a vital and critical part of this community. We want to protect them as well. So, part of the conversations part of the conversations happening in groups such as the Federal State Advocacy Group is how we can also access emergency relief funds for arts and cultural organizations as well.
So exactly how bad is our tourism industry suffering? According to Visit San Antonio, a public-private partnership that promotes tourism and conventions in the Alamo City, there are now 19 canceled citywide conventions this fiscal year that the organization had contracted. That has resulted in more than 114,000 lost hotel room nights and a projected $65.6 million loss in economic impact. So far, there have been no conventions canceled after the first week of August. Visit San Antonio also says there have been 28 canceled in-house meetings. There are meetings the organization is involved in, but they're supposed to be held at individual hotel properties. Now, these cancellations have resulted in nearly a $15 million loss. And let's take a look at the latest COVID-19 numbers in our surrounding communities. Comal rising to 29 cases today and also reporting its third COVID-19 related death. Hays County now has 61 cases. Guadalupe County is reporting 46 cases. Wilson County has 8 cases, while Atascosa County reports 5 cases, and Medina with 7. Kendall has 9 cases, and Bandera County remains at 0 cases tonight. Well, statewide, there are 9,300 cases and 177 deaths. The U.S. now has 430,000 confirmed cases and 14,600 deaths. Globally, there are now 1.5 million confirmed cases and more than 88,000 deaths. Well, let's turn to tonight's 9 at 9. Bernie Sanders has dropped out of the race for president, and Georgia mayor helps break up a fight at a Walmart. Plus, a look at how COVID-19 is impacting communities across the globe.
Here's tonight, 9 at 9. In the United Kingdom, the man who drove the truck in which 39 Vietnamese migrants suffocated last October has pleaded guilty. Maurice Robinson appeared before the court via video link today and admitted to the 39 counts of manslaughter. 3 other men also charged in connection with the case have pleaded innocent. El Salvador residents are now required to wear masks in public to prevent the spread of COVID-19. Government officials say they don't intend to fine people who don't comply, but police have the power to enforce the measure by doing things like preventing those not wearing masks from entering grocery stores.
The man arrested at a Universal City motel this morning after an explosive device found inside his room.
Joshua Falid taken into custody at the Super 8 motel on Palisadas Drive.
The Bexar County Fire Marshal's office says the arrest stems from an earlier incident. On March 25th, an explosive device was found in China Grove. Investigators were able to trace it back to Falid. Vermont Senator Bernie Sanders has ended his presidential campaign. The move clears Joe Biden's path to the Democratic nomination and a showdown with President Donald Trump in the general election in November.
While this campaign is coming to an end, our movement is not.
Eli Lilly says it will limit the out-of-pocket cost of insulin to $35 per month. The move is an effort to offset the financial hardships due to the coronavirus pandemic. The copay cap will cover the majority of the pharmaceutical company's insulin. The program is open to the uninsured as well as commercially insured people with type 1 diabetes. But the pharmaceutical company says it is not available to Medicaid or Medicare or Medicare Part D patients. Dick's Sporting Goods is furloughing most of its 40,000 employees. The closure of gyms, schools, and social distancing rules have zapped demand for sports gear. The athletic goods retailer is still filling online orders and offering curbside pickup. The furloughs are effective Sunday. However, workers will continue to receive their benefits. The mayor of Savannah, Georgia helps break up a fight in the middle of a Walmart. This cell phone video shows the brawl. The mayor says he helped defuse the situation and thanked the team at Walmart for handling it well. He also reminded the public about the importance of social distancing when in public.
We knew last Saturday that Walmart was like the club. We knew that.
Luckily, no one was hurt during the fight. Starbucks is committing $10 million to help out people in their company who are affected by the coronavirus. It's part of a new global partner emergency relief program. The company says it'll help cover expenses for housing and utilities, or if someone loses their home. It'll even help with funeral expenses. Take a look at this. A Wisconsin farm just welcomed a 2-headed goat into their family. They named him Janus.
It's after a Greek god that has 2 heads, and it means like duality, beginning and ending, and yeah, so I thought it fit pretty well.
He's one of about 1,000 goats born on the farm this year, but the only one with 2 heads. To read more about these stories, head to KSAT.com.
Hey everybody, good evening. Meteorologist Sarah Spivey here with a look ahead to your Thursday forecast. The biggest thing about Thursday that we're going to be keeping an eye out for is the potential for severe weather. But first, let's go ahead and take a look at the day. Today was particularly warm. We saw a high temperature of 92 degrees, well above seasonably average by 13 degrees. That's because we had a lot of sunshine, but because of the humidity, that 92 actually felt like 98. So if you did step outside today, you definitely felt the humidity. The humidity, just one of the ingredients for storms and the storm potential tomorrow. So let's just get right into it. Let's talk about tomorrow's future cast. We're going to see a cool front moving through the KSAT 12 viewing area by the midday hours. That's going to fire off a broken line of storms west of San Antonio around the lunch hour. Then, as we head into the early afternoon, we'll start to see those showers and storms develop near San Antonio, becoming more numerous east of I-35. So east of I-35, that's the best chance for a few thunderstorms. But again, because the atmosphere is supercharged right now, we do have the potential for some severe weather. So I want to take you through a timeline. Right at about noon, those storms will be west of San Antonio. We probably won't see any storms in San Antonio, but between about 2 o'clock and 6 o'clock, that's when we have the best chance for storms in San Antonio, about 60%. And again, some of those storms may become severe. Then after sunset, those storms will be ending and we'll just be left with a lingering shower or two into the late evening hours. So what am I saying when I say severe weather? Well, here's the potential storm threats for any of those storms that become strong tomorrow. Hail is going to be the biggest threat, potentially hail the size of golf balls or larger. Then right behind it, there's a decent chance for some damaging wind gusts of up to 70 miles per hour or higher. That's straight line winds of 70 miles per hour. There is a small potential for some flooding issues as well, just because we've seen so much rain since this past weekend, but we'll keep an eye out for that as well. And there's a very low tornado threat. So the biggest concerns, again, going to be hail and damaging straight line wind gusts. Then once that front moves through, honestly, it's going to be pretty nice. On Friday, though, it will be cloudy, a lot cooler, and there will be some areas of isolated rain. Saturday and Sunday will warm back up into the 80s. Then another front will allow for a much cooler start to early next week. But the good news is sunshine next week. So just the next couple of days, scattered severe storms tomorrow, particularly in the early afternoon and early evening hours. Isolated showers on Friday, it'll be cloudy. Then scattered storms return on Saturday, but that front will arrive on Easter, allowing for skies to clear. It'll be beautiful on Easter Sunday, a little on the warm side, and then cool with plenty of sunshine next week. Now we'll have more information for you as we continue to track the potential for severe storms tomorrow. For now, have a good evening.
All right, thanks, Sarah. Coming up after the break, Steve Spriester will talk to Mayor Ron Nirenberg and bring him your questions.
Welcome back. Fighting fear with facts. It's what we're attempting to do every night during this pandemic around this time. Tonight, we're joined by Mayor Ron Nirenberg, who did his briefing now every day, and I appreciate him every Wednesday coming on and answering some of your questions. Mayor, thank you for joining us tonight. First question, is faster testing on the way? And I would even go farther than that. Are you frustrated at all with the amount of testing you're seeing, and particularly with how long it's taking to get the results back?
So let me answer the first part first. Faster testing is on the way. Unfortunately, there is still a federal approval process, FDA approval, that has to be cleared. And then, of course, there's just a relative bottleneck with the amount of testing that's needed to get out in the communities. And right now we've seen the federal government, FEMA in particular, purchase all of the available rapid testing that has created a backlog in all the communities waiting for them. So to answer the second question, yeah, it has been frustrating. Clearly, the United States was not prepared in terms of the available testing capacity. That's been documented and debated for a long time now. But every community in the country faced with pending community-wide infections is working to get those tests. They're coming finally. We're actually seeing a couple of private providers now that are starting to validate the tests, the faster tests. We're actually seeing in our pre-approved lab at Freeman Coliseum, they're able to get those test results turned around in 24, sometimes 48 hours through a local lab. So things are getting a lot faster now.
Good. Next question. How can we get a true number of who is infected if testing is hard to obtain both financially and medically for people with no insurance?
Well, that's a great question. So testing is really ultimately the only way we can determine the actual level of infection. Everything else is extrapolated data from the testing that we have available. Right now, we have 554 positive tests or positive infections in our community. We do know that we're in a period of community spread, so the stay-home order is, in a sense, coming from the public health authorities' guidance that says we have to treat everyone we encounter as if they have the infection. We know the infection is much more widespread in this country than what the current testing shows because simply the testing has not been wide enough in any community. We're working in every part of this country to get it a much wider assessment, get more tests online as quickly as possible, but we do have to assume it's wider than what the data shows.
Yeah. Next question. Mayor Nirenberg, with numbers going up, have you thought about shutting down grocery stores and allowing them to only offer curbside service?
So the stay-home order falls in line with the Department of Homeland Security and the governor's order, which is quite similar to what we've had in San Antonio and other urban population centers in Texas. Unfortunately, we are limited in further restrictions based on the state order. We cannot go more restrictive than the state in terms of what is deemed an essential activity. I will say this, there are certain essential activities that keep, households running. Food security, food supply is one of them. But the grocery stores in this city and in Texas, particularly HEB, have been very proactive in implementing social distancing guidelines. It's unfortunately very difficult to regulate, but we're seeing much more proactive work being done in those essential businesses to make sure that people are staying 6 feet apart and that there's no spread. It's also one of the reasons why we're guiding people to wear cloth masks when they're out in public.
Is there a number or email to report an assisted living facility for not being compliant with the city's emergency orders? And of course, this has to do with the fact that we've seen 10 people who died on the southeast from that nursing home facility. Is there a number to call if people want to report something?
Yeah, so nursing facilities, long-term care facilities are actually state regulated, but we can filter any violations of our order, stay-home order, or get them to the right place simply by calling 210-207-SAPD. Any violations of that order we have to take very seriously because ultimately we're trying to prevent the spread of the disease.
Next question also has to do with nursing homes or assisted living facilities. Who takes care of residents in nursing homes or assisted living facilities if staff members become infected and have to self-quarantine? No long-term caretakers are allowed to work at more than one facility at a time.
Yeah, that's right. And these are very difficult conditions. And a lot of the residents in nursing home facilities have a lot of underlying conditions. They're older. And so it's a population that we have to be very careful with and care for. So the nurses and technicians and workers in nursing home facilities are on the front lines of this battle, which is why we're trying to equip them with the proper PPE and protocols to keep themselves and their communities safe. And they do some very, very difficult work, and most of them are doing a very good job of it. Unfortunately, they do become vectors of infection if there is a virus introduced, and that's why we put the order in, which is similar to the CDC guidance, to make sure that they're only working in one location so it doesn't spread inadvertently to other locations. But they're the front line, and the management companies have to ensure that their workers are treated well and that there is a supply of workers in the event that somebody goes down ill, because we want to make sure that no worker is forced to work if they're not feeling well, if they're symptomatic, whether or not they have a positive infection or not.
Next question has to do with the homeless population. We had Kenny Wilson, the CEO from Haven for Hope, on Monday night. He kind of answered this first question, what are the homeless numbers on the coronavirus? He said he didn't know of any that had tested positive. So I kind of answered this question, but what is the plan if somebody that's homeless does test positive to kind of keep them, quarantined?
A couple things. One, if there is a positive, we want to get that person isolated into shelter so that they're not infecting others as quickly as possible. And so we've had for several weeks now a facility under contract where we can do that. Thankfully, we haven't had to use that isolation facility. In addition to that, though, we know the shelter environment, if it's not well managed, generally is kind of a crowded location. So we've been working with Haven for Hope and other shelters to provide for a relief facility so that we can create a little bit more space in the shelters and make sure that we get especially the vulnerable members of our homeless population, a little bit older or immune compromised, into a place where they can be, be better cared for. That's happened literally around the clock for the last week. We've been working on those types of facilities. We've got something in place now. And so I think that the homeless shelters are in much better, stronger position to ensure that they're not vectors for infection.
Before you go, I want to talk to you a little bit about the furloughs that were announced today. Again, not firings, not some people being laid off, they're furloughs. It has to do with the hotel occupancy tax and the fact that the hotels just aren't full right now.
Yeah, well, the visitor industry, travel and tourism has really been devastated over the last 2 months, not just here in San Antonio, throughout the country. When the planes stop flying and people stop visiting locations, they're staying at home, it really impacts travel and tourism. And so certainly that's our hotel and occupancy tax, which unfortunately funds in a dedicated manner some particular city operations like convention and visitors. So that's been difficult to work through. Fortunately, we have very forward-looking management. We have for the last 10, 15 years in this city. And so we've afforded ourselves ability to care for our employees who we want to keep part of this organization, but are now able to furlough. So they are able to get some of the federal benefits associated with furlough and unemployment, but stay part of the city, continue to get the city health care and benefits, and stay part of the organization. So as soon as the visitor traffic starts to pick up again, we can get back up and running very quickly. So, this is tough. Every organization is going through this. We want to make sure that our approach is people first.
I know when I hear hotel occupancy tax, I know it goes to so many different things. But one of the main things it goes to is arts and culture in our city.
Yeah.
So what does it mean for some of the programs out there that are city funded or partially city funded Luminaria and some of the other things?
So this is ongoing work with the city organization, with city management. So what we know is this: there's going to be some belt tightening. There is also going to be a lot of work with our state and federal government to pull down relief funds to fill the gap. I will say this: our city's identity is built on its arts and cultural community. It's going to be very difficult for some time to weather this fiscal storm, but we're going to get through it. And I am guided by the old adage in wartime when arts organizations were being decimated, and someone said, with the arts being cut, then what are we fighting for? Our arts are part of our life, our soul, our heritage. We have to protect them. It is going to be challenging several months, but we're going to work with everyone in the arts community to make sure that we get through it together and we get everybody back on their feet as quickly as possible, because that is our city, our character, our soul. And we want to make sure our arts community thrives when this is all over.
Yeah, this is not a permanent thing.
No. We need to get through this, obviously, but then we need to get back to seeing the arts and culture continue to lead this city into this century and being one of the great cities of the world.
Mayor Ron Nirenberg, thank you for your time every Wednesday. I really appreciate it.
Anytime. Thanks a lot, Steve.
All right, take care. We'll be right back.
You too.
Here are today's top stories. A San Antonio man is in FBI custody after he allegedly posted on Facebook claiming he paid someone to spread COVID-19 at grocery stores. 39-year-old Christopher Charles Perez was arrested yesterday in New Braunfels. FBI officials found the alleged threat to be false and no one had spread COVID-19 at grocery stores. Perez faces up to 5 years in federal prison if convicted. 2 more confirmed COVID-19 cases at the Bexar County Jail resulted in the lockdown of all Bexar County detention facilities for decontamination. A deputy and civilian employee tested positive Wednesday morning. The lockdown only affected non-public parts of the jail. The deputy who contracted the virus is a recent graduate, leading officials to believe the virus was contracted through another deputy. The entire class was placed on leave. To date, 4 BCSO employees have tested positive for COVID-19. Walgreens is working with government agencies to add 15 drive-through coronavirus testing locations. Walgreens says it's using a new rapid coronavirus test that can yield results in under 15 minutes. The FDA approved the test under an emergency authorization last month. The locations of the Walgreens sites aren't finalized yet. They are planned for areas with escalating rates of COVID-19. Most of us are at home for work or school and have been forced to use different video conference services to stay in touch with others. Some of those services include Google Hangout and Skype, but there's been a disturbing trend for people who use Zoom. RJ Marcus explains what Zoom bombing is and how you can prevent it.
In the past few days, you may have heard of something called Zoom bombing. It's when a hacker crashes your online meeting and posts profanity, graphic videos, or content that may not be safe for school or for work.
Since people have been forced to stay home to social distance, Zoom's daily users have ballooned to more than 200 million in March. Reuters reported those numbers jumped from a previous total of just 10 million. It may be good for business, but it's also given hackers several more chances to infiltrate classrooms and work meetings. There has been such a spike in Zoom bombing cases that FBI officials in Boston warned people to beware after 2 schools saw their online classes get hijacked. In the first case, someone yelled a curse word and then shouted the teacher's home address in the middle of class. In the second case, the hacker showed up on the video camera and displayed racially charged tattoos. So how can you prevent this from happening? Start with not using your personal meeting ID for the meeting. Instead, use an ID that is exclusive to a single meeting. Enable the waiting room feature so that you can see who is attempting to join the meeting before allowing them access. Disable options such as the ability for others to join before the host, then disable screen sharing for non-host. Once the meeting begins and everyone is in, lock the meeting to outsiders and assign at least 2 meeting co-hosts. Zoom's support page can help you with each one of these settings.
These tips are not completely foolproof, but at least hackers will have to go through several hurdles before they crash your next meeting. For the 9, RJ Marcus.